Hello viewers, welcome to my channel Human Diseases and Genes. In this video, I will discuss about Kawasaki disease. Kawasaki disease was first reported in 1967 by Dr. Tamisaku Kawasaki, a Japanese pediatrician. Dr. Kawasaki initially described the condition in a series of cases involving children with a distinct clinical presentation which included prolonged fever, rash, conjunctivitis, and other systemic symptoms. His detailed observations and documentation led to the recognition of Kawasaki disease as a distinct clinical entity, and it has since become a well-established diagnosis in pediatrics. Kawasaki disease is an acute, self-limiting vasculitis that primarily affects children, particularly those under the age of 5. It is characterized by inflammation of the blood vessels throughout the body, including the coronary arteries. The disease is notable for its potential to cause serious cardiovascular complications if not treated promptly. The prevalence of Kawasaki disease is notably higher in countries of East Asia, particularly Japan, where it was first reported. In Japan, the incidence can be as high as 100 to 150 per 1 lakh children under 5 years old. The prevalence of Kawasaki disease is lower in Europe, Africa, and the Americas compared to Asia. In the United States, the incidence is around 10 to 20 per 1 lakh children. Clinical symptoms are fever, rash, conjunctivitis, strawberry tongue, cracked red lips, swelling and redness of the hands and feet, peeling of the skin around the fingertips, lymphadenopathy, abdominal pain or discomfort, diarrhea or vomiting, formation of aneurysm in the coronary arteries, which can lead to coronary artery disease, myocardial infarction, and other health issues. The exact cause of Kawasaki disease is not well understood. It is thought to be an autoimmune response triggered by an infection or other environmental factors. Kawasaki disease is a complex condition with an unclear etiology, but research has identified several genetic factors that may contribute to its development. While the exact genetic cause are not fully understood, some genes and genetic variations have been associated with an increased risk of Kawasaki disease like IL-1, toll-like receptor gene, FCGR2A and FCGR3A, STXBP4 genes, etc. A diagnosis is primarily based on clinical presentation and exclusion of other conditions with similar symptoms. Blood tests and imaging studies may be used to assess inflammation and potential hurt involvement. Early treatment with intravenous immunoglobulin and aspirin is essential to reduce inflammation and prevent complications such as coronary artery damage. This is all about Kawasaki. Thanks for watching. If you found this video helpful and learned something new, please like this video. Don't forget to subscribe for more health insights. Share this video with friends or family to spread awareness. If you have any questions or queries, drop a comment. Don't miss my next video. Until then, stay informed and take care of your health. Thank you very much.